But in your view, would that be cause for reporting?
Well, I don't think I can really get into second guessing the clinical judgment at this point, but I think it's definitely a cause for concern, whether it's a cause for reporting or not.
Are you second guessing the clinical judgment if you release this doctor of his?
I'm sorry?
If the doctor is no longer working at the clinic, wouldn't that be a indication that you are second guessing his judgment in this case?
Well, actually, this happened to be a strange coincidence of timing. We had made a decision a number of months ago that we were going to minimize the utilization of so-called temporary or float doctors because we had just a general purpose belief that it's better to have continuity of care. And so at the board a few weeks ago, we added some permanent positions in order to hire permanent physicians to substitute for these. So that process had been ongoing, and this particular physician was a temporary physician, and because we have those permanent physicians, we really no longer have need of his services.
So you're saying there's no relation between him no longer being scheduled in this case?
I think that the review of the medical situation speaks for itself.
Do other people have questions about this? Okay.
I don't know if it's at all possible. I know we came very with that. Would you be able at all, then, or you're interested in perhaps repeating the beginning part of what you said? I hate to have to ask.
Well, actually, we have a handout which we will give to all of you that has some of the information on it that you probably missed. So I think, if you want to wrap up, maybe you'll just repeat some of the beginning part.
Yeah. Just want to wrap up by reiterating again that this was the death of a child, which is always a tragedy. This is even more of a tragedy when the child's in protective care. And we want to make sure that the systems in our health services department are cooperating with the systems in employment and human services to make sure that whatever can be done to prevent this kind of outcome again will be done. We all know that the child died of baking soda ingestion. And with 20/20 hindsight, I think many people are saying what could have been done 1 month, 2 months, 1 week, 1 day before that. This was a huge tragedy. The baby was poisoned and died. But I think that it also offers us the opportunity to find out what, if anything, could be done better in terms of providing medical care to foster kids.
Could you, I know on the coroner's report it lists, as you said, the poisoning with the high levels of baking soda.
Yes.
Can you describe how her emaciated state might contribute to, if I were to eat that baking soda, would I be okay versus someone who was in a much thinner state than I am? Am I making this question clear or no?
No, I think it's a legitimate question, and I think it's true that if you are underweight, in a state of malnutrition, before you ingest a toxin like sodium bicarbonate, that your body is less able to handle that load, so that certainly could contribute.
And can you tell us, 17 pounds or 24 pounds, on a normal range, is it even in the normal range for weight of a girl her age, or is it way off the end?
The 19-pound weight in the Pittsburg Health Center was below the 5%. It's way off the mark of what we want to see.
So you say below 5%, meaning the 5th percentile?
5% of anticipated rate, the 5th percentile. And
Which
so,
is basically off the
which is
charts.
the reason for the referral for evaluation of failure to thrive.
Saying that she's off the charts, is that correct or not correct? She's
Yes.
below the 5%. So
Below.
she's so low, her weight was off the chart, basically.
Below the 5%, yes.
How much would a baby her age and her height usually weigh? Like a healthy baby?
About
Probably 24, 25 pounds.
Yeah.
So was there an appointment made with a pediatrician?
Yes.
For what date?
It was 4 days after the 20th, so 10/24. 10/24 was
October 24th.
yeah.
Okay, but in the more recent case, the November to December 7th?
Oh, after the visit on the 30th.
On the 30th, beg your pardon.
I don't have that information. I don't know.
Okay.
There was a referral made. I don't know if there was actually an appointment scheduled.
you're saying there was a referral made by or there was a disappointment in this short notice clinic was made, you don't know whether it was by the foster mother?
We don't know who it was made by. We know it was made 2 or 3 days before the visit.
But she went with her.
The foster mother was with Deonna.
And the previous one,
The
child
biological mother
was in the custody of the biological mother at that point.
Correct.
Do you know when the child entered CFS, or can you not say?
We don't know.
Okay.
We don't know how the custody changed.
Well, thank you all. I guess you now all work for the plane crash, so thank you for
Actually,
coming.
I have just a couple more questions,
Oh,
if that's okay.
Sure.
Sorry, was there any indication that this doctor made an effort to report this child's weight or any other signs to CFS? The November 30th
No.
doctor? Okay. Were there any other signs on the chart other than the weight that would point to any sort of neglect or abuse issues?
No.
That was the main thing.
That was the major abnormality listed on the chart.
Is there any feeling from health services that, you know, I know Dr. Walker said, you know, we're all looking back, hindsight 2020. Is there any feeling of responsibility from the health services department in what happened here?
I think we always feel responsibility when we've seen a patient, any patient, before something bad happens. And again, with 2020 hindsight, could we have done something different? That's the lens with which we're looking at this incident.
The coroner's report talks about abdominal trauma of some kind. Was that indicated at all in either of those visits?
No, it was not.
How did it become a well baby check? The CFS is reporting that that this Pittsburgh visit was a well baby check. Do you know how that got mixed up from an emergency visit to a well baby check?
I don't know how it got mixed up. I can speculate that it might have just been because of the form that was used to fill out the visit report. It's sort of the standard form that's used typically for well baby checks, but it wasn't a well baby check.
Right, and she wasn't a well baby at that point. She wasn't considered a well baby.
Well baby check terminology means you regularly schedule appointments at certain milestones.
Right.
18 months, 24 months, that's what a regular well baby check is. This was not that. She was not brought in because she hit a milestone. She
Okay.
was brought in because the foster mother called for a short notice.
Okay.
So how would CFS know about that? How would that get back to them? The results of that check? If it wasn't a scheduled sort of CFS mandated or whatever well baby check, how would they get the information on what happened?
They have access to any of our records that are made on their wards. And so they know when the patient's seen, they can request the records, they can review the records. They essentially sort of substitute as parent, and so they can request it anytime they
So
want.
the doctor they don't fill out a special form that goes to CFS, it's just that the medical record is there,
Right,
unless there's a report.
right.
Okay, thank you. And if you have any feedback on this room, let us know whether it was good or bad, because, as I said, we usually do our press conferences outside. Obviously, it's raining today, so let us know how this worked for you. Thank you.
Yeah, let us know what happened at Buchanan.
Yeah, right.
Thanks for the news tip.
Sure.
Yeah, thank you.
All right.